The neck doesn't lie. It shows facial aging before the rest of the face actually does, and there is a reason for this. Understanding that the reason as a surgeon is something that separates obtaining natural results versus unnatural results. I'm Dr. Tatiana Luna, board-certified plastic surgeon in Bogotá, Colombia, specialized in advanced facial rejuvenation, and I'm gonna talk to you about the importance of the neck in facial rejuvenation. The neck is one of the most structurally exposed areas of the face, starting with the fact that it goes against gravity, the skin is thinner, and also the platysma, that is the muscle that we have in this area, loses tone faster than the rest of the muscles. At the same time, with aging, the structures of the face begin to descend, and the first place where that descent is visible is where the face meets the neck, at the level of the jowls, at the angle of the mandible, which lose definition, and that's why this area is so important addressing in facial rejuvenation. The deep plane is a game-changer technique in the matter of the neck, because before, with traditional face and neck lifts, they used to just pull out the skin, and this had unnatural results that didn't last long, especially at the level of the neck, that, as I mentioned, is against gravity. But when we do deep plane, we address the deeper structures also of the neck. So we go underneath the platysma muscle and we release all of the ligaments and structures that are retaining the neck at that position. We remove the subplatysmal fat and we do suspension sutures underneath the chin to try to bring back that cervical angle that looks so useful and natural. When the underlying architecture is restored, the skin follows naturally. So the result will look like yourself, but more youthful and like you used to look some years ago. And since this support is structural, the result will last longer. In my practice, I never treat the face in isolation of the neck. Since they age together, they need to be addressed and restored together. The platysma is directly addressed through a submental incision, and the rest of the dissection is done through the same incisions of the deep plane facelift. That means kind of the same amount of scar, but treating two different areas that will give you a more comprehensive and long-lasting result. The neck is often where the conversation about facial rejuvenation begins. Many of my patients in consultation, I ask, what is the thing that bothers you the most? And I would say 60 to 70% would answer that the neck is their main area of concern. That's why in a facial rejuvenation consultation, you need to make sure that your plastic surgeon is specialized in deep plane techniques, and also that they are going to address the neck as a comprehensive part of your facial rejuvenation. If you're starting to notice changes in your neck and you want to know what really is going on there and what your options are, please leave me any questions in the comments below. I'll see you in the next one.